Hello everyone, welcome back to my channel, and today we are here with a new video on kidney. Okay, so we are going to see the topic kidney for histology. So starting off, we'll be just covering 10 points, the diagram. Starting off with the first point, kidney is covered with a thin connective tissue capsule. So as we can see in the diagram, this is a thin connective tissue capsule. So this is the covering of the kidney. Kidney is covered with a thin connective tissue capsule. So we all know, we have read that kidney is covered by renal capsule, right? So it is a thin connective capsule which you will be drawing like this, right? So second point, it is divided into outer cortex and inner medulla. So we all know the kidney is bean shaped, and outer part we have the cortex and the inner part we have the medulla. Now what does the cortex contain and what does the medulla contains? The cortex contains renal corpuscle, PCT and DCT. So obviously the kidneys are made up of nephrons. Everyone is aware of that. So now when we take a nephron, we have various parts in it. The glomerulus, the Bowman's capsule, PCT, loop of Henle, DCT and the collecting duct. Now, the cortex contains the renal corpuscle, PCT and DCT. Look at this image. So, till here we have our cortex. And this cortex contains PCT, DCT and the renal corpuscle. So the renal corpuscle is made up of the Bowman's capsule and the glomerulus. Together they are called as renal corpuscle. So the cortex is made up of PCT, renal corpuscle, which is nothing but the Bowman's capsule plus the glomerulus, and the DCT. So if we see that in the image, here we have the Bowman's capsule. Inside we have the glomerulus. Together they are called as the renal corpuscle, and this is our DCT and this is our PCT. Okay. So Bowman's capsule plus glomerulus called as renal corpuscle, DCT and PCT. These are present in the cortex. Medulla contains loops of Henle and the collecting duct. So this is our loop of Henle and this is our collecting duct. So this blue color part over here till this is the medulla. So medulla contains loop of Henle and collecting duct. So this is cortex image. So you cannot see the loop of Henle and the collecting duct in this picture. Next point. PCT is lined by simple cuboidal epithelium with brush border. So brush bordered simple cuboidal epithelium. So this is our PCT, that is proximal convoluted tubule. Okay, so this is lined by brush bordered cuboidal epithelial cells, and the DCT is lined by simple cuboidal epithelium without brush border. So this is important. PCT has brush bordered epithelium and DCT doesn't have brush bordered epithelium, but both are simple cuboidal epithelials. Okay, so this is our DCT without brush border but simple cuboidal epithelium. Next is juxtaglomerular apparatus. So when we tell JG apparatus, it is formed by the macula densa cells, macula densa and the JG cells. It is formed by the macula densa and the JG cells. Collecting ducts become larger towards the papilla, and the main function is urine formation and regulation of fluid electrolyte balance. So what is the main function of kidney? Of course, the urine formation, which is the primary function. By doing urine formation and excreting the urine, it is regulating the fluid electrolyte balance in our body. So let us just recall once. The kidney is covered by a thin connective tissue capsule. It is divided into cortex and medulla. The cortex contains PCT, renal corpuscle and DCT. Renal corpuscle is made up of Bowman's capsule and glomerulus, and the medulla contains loop of Henle and the collecting duct. Now till medulla here, okay, till this we are done. Next, the renal corpuscle contains glomerulus and Bowman's capsule, that we know. So first 5 points are clear. Next, we have to talk about the epitheliums. PCT is lined by simple columnar, not columnar, it is cuboidal. PCT is lined by simple cuboidal epithelium with brush border. DCT is lined by simple cuboidal epithelium without brush border. And then we have to talk about the JG apparatus, that is JG apparatus is formed by macula densa cells and JG cells, and the collecting ducts become larger towards the papilla. The main function of kidney is urine formation and regulation of fluid electrolyte balance. So these are our 10 histology points for kidney, and the diagram, hope we are clear with it. We have the capsule, we have the Bowman's capsule, glomerulus, which collectively called as renal corpuscle, DCT simple cuboidal without brush border, PCT simple cuboidal with brush border, and we also have some blood vessels here and there. Done. So yeah, just few points about kidneys histology. Hope you understood and enjoyed the video. Thank you. Please like, share and subscribe.